We're super happy to be here from the De Beaumont Foundation and to be sharing a little bit about how we think about public health infrastructure and to give you some tools around communication. Mariah, do you want to go to the next slide? Okay, so you've already seen our pictures. I'm Katie. My colleague Mariah is here as well. As Mackenzie said at the start, I work on both our partnerships portfolio and our communications projects at De Beaumont. So this work is right at the intersection of things I do. But the phrases work, which Mariah is going to share more about, predates me at De Beaumont. So you'll get to hear from Mariah, who is actively there for it as we move forward. So for those of you who don't know De Beaumont, we are a private foundation. We're based in Bethesda, Maryland, but we work nationally. And our mission is to advance policies, build partnership, and strengthen public health infrastructure to create communities where everybody can achieve their best possible health. So we do work across a range of things that touch public health. We're really, I think, the only major funder in the country that focuses on public health specifically rather than health more broadly. And we have a real interest in supporting and upholding governmental public health. So when we talk about policies, partnerships, and workforce, we're really thinking about those of you who are working in the public health field, and particularly those of you who are working in governmental public health. Mariah, I think with that, I am going to hand it over to you. I'll take a minute a little later on and share the bigger picture of what we're kind of doing in the communication space, but want to give Mariah space to share kind of how we think about these questions and set up the conversation.
Yeah, thanks, Katie. So as Mackenzie said in my introduction, what I work on mostly at De Beaumont is the Public Health Workforce Interest and Needs Survey. And as Katie mentioned, I have also worked on the Phrases project. Phrases also predates my time at De Beaumont, but I worked on it before I came to De Beaumont. So I've been working on Phrases since 2018, and I'm excited to share it with all of you today. Before we get there, I know your entire day today has focused on the public health infrastructure. And so there is a little bit of disconnect potentially between talking about communications and public health infrastructure. So we wanted to kind of bridge the gap between those two things. So I'm going to just give a quick overview of how we think and view the public health infrastructure. And I apologize for the gray box popping up at the top of my screen. I will continue to hide it if it keeps popping up. And the gray box in the middle will go away shortly. But let me start with that, and then I'll pass back to Katie to talk a little bit about our communications projects, and then we'll kind of dive into the work of Phrases. So I want to start with just some level setting. So we all probably, none of this will be surprising to all of you, but public health workforce before COVID and the decade prior, healthcare spending in the United States increased by $1 trillion, while state and local governmental public health spending was stagnant or declined during that time. And we also saw deep declines in our staff size. So we saw declines between 30,000 and 40,000 full-time equivalents. And there's no reason to believe there's less of a need for public health services in the US, or that there has been a reduction in the scope of the essential or foundational public health services that the state and local governments of public health workforce should be able to provide. And in fact, a study found that the nation needs 80,000 more full-time employees in state and local health departments to provide just the foundational public health services, which is an increase of about 80%. And again, that's just for those basic community services. So we're not even talking about things like COVID. And then COVID hit. And what we see through data actually from PHWinds is that nearly 3/4 of the state and local governmental public health workforce was reallocated to serve in a COVID-19 response role. And that reallocation occurred across essentially every public health setting, program area, job type, demographic category. It happened throughout health departments at the state and local level. And additionally, we saw that 75% of all new staff hired during that time, so during 2020 and 2021, which was the period the survey captured, 75% of that group served in a COVID-19 response role. And I mentioned that it affected almost every program area. And so if we just dig quickly a little bit deeper into that, you can see that over 90% of both the all hazards and communicable disease workforces were either fully or partially deployed to COVID-19 response roles. And I'll explain a little bit more on that on the next slide. But I also want to point out here, communications staff, 72% served in a COVID-19 response role. And even the program area with the least deployment, maternal and child health, still saw over 55%, 55% of its workforce deployed to those COVID-19 response roles. And then what you see in this graph is that from, I'm going to just kind of point out a few time periods, is from April 2020 to March 2021. So we're looking at Q2 2020 to Q1 2021. We see that nearly half of the workforce spent more than 3/4 of their time on COVID-19 response activities. And so I want to specifically point out the two lines at the top here. So I don't know if you can see my mouse, but this dark blue line here is the all hazards category that I spoke about on the last slide. And this lighter blue line is the communicable disease workforce, which I also spoke about. So you can see here from those two time periods that I mentioned, Q2 2020 to Q2 2021, we're actually seeing that these two categories in which 90% of the workforce was redeployed to COVID, you're seeing that 70%, over 70%, they were spending over 70% of their time on COVID-19 response roles. So just think about kind of the level of all of that. And I think we can also see that across any time in 2020 and 2021, more than half the workforce, because we know that more than half the workforce was devoted to COVID at points in time, were serving at least 1/4 of their time on COVID, which is crazy to think about. So the reason we kind of wanted to set the stage is because we already know that the workforce was lacking staff and money, and then COVID hit and it was lacking staff and money even more. And so that makes communication actually super important when it comes to bolstering up public health. It becomes really important for, obviously, for advocacy reasons to get more money and more staff, but also to expand our message to other sectors so that the general public understands what we're trying to do. And Katie will talk a little bit about that. But we just wanted to do a quick pause and ask you all if you found any of this information surprising. So you should see a poll pop up on your screen, and you're probably seeing a gray box on mine. And also, if you did find it surprising, we're curious what you found surprising. If you'd like to drop that in the chat, we'd love to read it. So I'll just give everybody a few, like 30 seconds to finish the poll. Okay, I'm going to end the poll. Perfect. So we are seeing that a little over 25% found this surprising, and a little under 3/4 found it not surprising, which I don't find surprising either. Okay, so I'm going to pass it back off to Katie to talk a little bit about communication, why communication is important, and some of de Beaumont's communication projects.
Thanks, Mariah, and you set me up perfectly here, because one of the things I usually say is that public health had a communications problem long before COVID. We know that really strong communication is essential to doing the work of public health. If folks can't understand the things that they need to do to remain healthy and the way that public health works, it's very hard for us to foster really healthy communities. And this is a longstanding problem that's been underfunded and underinvested in, but it has gotten a lot worse through COVID. And I think COVID really shone a spotlight on some of the challenges that we have around effective communication across the field, across the board. So we know, as Mariah said, that the public health workforce is understaffed and also particularly undertrained in this area of how to communicate effectively. And we know that the job of doing that is getting harder over time. So I don't need to tell all of you this, but we are seeing rapidly circulating misinformation. We're also seeing really heightened polarization across the country, as well as a real drop in trust in all public institutions, including public health. And that makes this job both harder and more important. So we at Beaumont are investing a lot of resources in helping to support folks like you in effective communications around public health, to help you really put out science-based messaging, to figure out how to combat misinformation, especially because we know that the majority of the health-based misinformation circulating on the internet is actually coming from within the United States. So our communities are generating this misinformation. We need to be able to figure out how to respond to it in our own communities. And we also need to figure out how to break down some of this polarization that we're experiencing that's really undermining trust and support for public health, at the same time that we are giving folks science-based, plain language ways of communicating the things that really matter in the field. So we're doing a lot of work in this space. Mariah is going to talk about phrases. Mariah, if you move to the next slide, it just has some visuals for everybody. Phrases, as Mariah said, is work that we started several years ago as we were thinking about how public health could really reach across sectors and what communications needs there may be to do that. So there's a lot of work that goes into effective partnerships. This is a big part of my job at the foundation, but those partnerships often don't even begin if we can't figure out how to communicate effectively across sectoral boundaries. And so that is really the work that Phrases undertook pre-COVID. And this has been a really successful foundation for us as we think about how we can expand the support that we're offering to folks on the ground and how they communicate. Some of you may have seen other things that Beaumont did during COVID around communications, including outreach to conservative voters, particularly around vaccine uptake. And also this book, which came out last year called Talking Health, which is based on a lot of the research that Mariah is sharing today from Phrases. And building on these two things, we have a robust portfolio in this space where we're doing a lot of different things to try and bolster support for this. So some of what I'm doing here is saying, watch this space because we're going to share some really good stuff with you today, but we are also actively working on this set of challenges. And so you'll see things from us coming out over the next year or so. For those of you who aren't familiar, the Public Health Communications Collaborative began in COVID with the intent of helping health departments communicate plain language, science-based messaging around COVID-19. We have since expanded what the Public Health Communications Collaborative messages on, and are working on even more actively expanding that over time, as well as expanding the collaborative more broadly to give folks training support, capacity building, to really support folks in thinking about how they respond to misinformation, and to put out research that will also support the field more generally in increasing its investment in public health communications. In addition to that, as a foundation, we're doing a lot of work right now on message testing. We actually have a poll in the field right now and some focus groups happening next week, getting at this question of polarization and how we can communicate effectively about what public health is and why it matters, particularly across lines of value, which we know is a real challenge that folks are having. How do they communicate the importance of their work in places where they're experiencing increasing distrust and skepticism of public health? So we're actively working on resources that can help you all do that. And then we're also investing a lot of resources in supporting health departments and others in public health in thinking about how they combat misinformation. So identifying misinformation as it's circulating in the ecosystem, but also thinking about when it's useful for you to respond. If you respond, how do you do that? How do you build that into a really robust communications plan that allows you to address these issues proactively, as opposed to a thing that I hear routinely from folks in the field, which is that we always feel behind and understaffed and ill-equipped to do this work. So that is a kind of vision for where this work is going. But the origin story of our work in communications really lies in Phrases and in this foundational work, which we continue to build on in our own practice and hope others are as well, about how we really communicate this value, particularly across sectors. So with that, I'm going to hand it back to Mariah for like the main show of what we're doing today. And then I'll come back at the end.
Thanks, Katie. So before we launch into all of the Phrases stuff, we have just a few questions for you about whether or not you consider yourself a public health communicator, how often if you're finding yourself needing to communicate about public health often, and whether or not you have the tools and skills you need to craft your message for your audience. Okay. We have a few more answers trickling in, but I'm seeing that the majority of you consider yourselves public health communicators and that you often communicate about public health. And 3/4 of you feel like you have the tools and skills, but there are about 30% of you who feel like you don't. So let's all learn something new today. And then as we kind of get started, we'd love to also just know who's in the room. So if you could in the chat drop in your name, whatever organization you're involved in, and a public health communication challenge that you're currently facing. We're going to kind of come back to those at the end, so you can start thinking about them now. And with that, I will kick it over to Phrases. So Phrases is the Public Health Reaching Across Sectors project. It's a communications toolkit really focused on helping public health professionals better communicate their value, specifically to other sectors, but the research is applicable across a lot of different spaces. So the project started because we wanted to help public health professionals understand what mattered to other sectors and how to craft messages that would resonate with those other sectors. And so this was the strategy, which is also our roadmap for today's presentation. So I'll kind of start in the space of what's needed, why this project's important, why cross-sector collaboration is important, which I'm probably preaching to the choir on that one. And then we'll talk about the gap, which is the gap in understanding between what public health usually tries to convey and what other sectors are hearing. And then we'll talk about filling the gap, which are the tools and resources that were produced through the Phrases project. And lastly, we'll focus on driving change, applying some of those tools and resources, and we'll end with a small activity to help you guys start thinking about things. So let's start with what's needed. So why Phrases? We know from Public Health 3.0 and real world experiences that we all have that to improve the health of people in all communities, it's critical that we address the upstream social and structural determinants of health. And that in order to do that, we have to partner with experts in those spaces to be successful. We also know that it's not always easy or clear how to develop these partnerships, in part because public health professionals are not generally trained in how to develop these collaborations. And then to complicate things a little bit more, we also know that public health is not an easy concept for many people to understand, and it's certainly not easy to explain. So we know that successful and effective partnerships begin with asking partners what they need, rather than starting the conversation with what we need, and that asking them what they need and want is a great way to find common ground. So I hope that through this presentation, we can think about those things and that Phrases might be able to help you build the confidence you need to overcome some of the barriers. Okay, just hiding those controls for you. So Phrases was a partnership between the de Beaumont Foundation and the Aspen Institute Health Medicine and Society program. And our research partners were Hadaway Communications and the Frameworks Institute. So as we talked about a little bit before, we saw during COVID, and more importantly, I think the public saw during COVID, that public health and health truly affects everything. So the 4 sectors listed here, education, housing, business, and health systems, are those that Phrases chose to start with. We know it's not an exhaustive list and that public health has to partner with sectors all over the place, not just these 4, but this is a really good starting point. So I'm going to come to you with two other poll questions. We're curious. What sectors do you currently partner with, and what sectors do you wish you partnered with? Okay, so currently partnering, I'm seeing a lot of education and a lot of healthcare. And wanting to partner with, I'm seeing people want to partner with housing and business, and there's also a lot of people are wanting to partner with other sectors as well. If you'd like to drop in the chat what other sectors you're hoping to partner with outside of these four, we'd love to know them. And keep all of those in mind as we continue to go through this. So now let's talk about the gap, which, as I mentioned before, is the gap in understanding between what public health says when it's communicating its value and needs and what other sectors actually hear. So to do this work, the Frameworks Institute, we worked with the Frameworks Institute, and they conducted a number of interviews and focus groups with public health professionals and those in those four sectors I mentioned to what they call map the gap in understanding. So over the next few slides, I'm going to share the results of these interviews and focus groups, and I'm curious if any of the findings sound familiar to you. Just so you know, I do have a video clip to show in this section, and I've got to kind of switch my sharing of the screen, so don't get dizzy from the choreography. Okay, so first, when asked how they would define health, participants in these focus groups answered that it had to do with the absence of disease. It was focused in hospitals and clinics and related to how an individual felt in the morning. And these are very individual and medical focused definitions of health, which we know is not often how public health professionals view health. And then when asked what impacts health, you again kind of see these individual and medical factors with someone mentioning diet and exercise, but then you also see some aspects of community come into play. Being subject to bad environments and also access to healthy food. Now, let's see what happens when we ask other sectors what public health is. Let me share this. Okay. Oops, hold on one second. Great. Can you see the video? Katie, I can only see you. Can you just give me a thumbs up if you can see the video?
Yes, I think so.
Okay, let's try it.
It's filling the whole screen, so it's hard. It's a little hard to tell.
Okay.
I think we're good.
Okay, great. All right, let's play this.
Into the water.
If I were to ask you what is public health, how do you think you would answer that question?
It's not an easy question to answer.
A lot of doctors have masters in public health, but I'm not sure what it entails.
If you work in the public health profession, aren't you concerned with policy or something?
When I think of public health, the first thing that comes to mind is healthcare for the poor.
Dealing with the healthcare needs of the indigent.
Certain facilities that are operated and funded by the government.
When I think of public health, I think about the CDC.
I think, first of all, the CDC and then the local Department of Health.
I think of the CDC. They kind of inform the masses.
Educated people.
Okay, let me go back to the deck. Okay, so as you all could see in that clip and hopefully hear, when asked what is public health, there were a lot of pauses, and slowly people did start to figure it out. There was people mentioned CDC, the one participant mentioned the local health department, but public health is something that's hard to understand. And so I'm curious, as I continue to kind of go through this, what are your reactions to this video clip? Were you surprised by what you saw, and have you experienced a similar situation? And if you'd like to share an example of how you might have overcome that, we'd love to hear that as well. Okay, and while you're all putting that in the chat, I will continue on to kind of what we found when we mapped those gaps, when Frameworks mapped those gaps. So I mentioned that those interviews and focus groups were used to kind of understand the difference between what public health thought about a topic and what another sector thought about a topic. So when thinking about health, which we kind of saw in the previous slide, public health views health as a positive state of integrated well-being. So something that's kind of integrated throughout your entire life, whereas other sectors really just saw it as an absence of illness. So if you were healthy, that was health. and nothing else. And when it came to the social determinants of health, which we all know we talk about in public health all the time, public health views the social determinants as factors that can promote or undermine health, whereas other sectors only saw them as factors that undermine, which we also saw in those clips earlier when someone said that environments impacted health or access to healthy food. But it's really those factors that undermine health is what other sectors see. And I won't go through all of these. There's an entire resource online at phrases.org as well. But the themes that we see throughout this are that other sectors consider health as individualistic and medical. They see cross-sector partnerships as awkward and difficult and with little return on investment. And they also see public health professionals as lacking the skills to have meaningful conversations with other sectors or being able to meaningfully contribute to the work, which I think we all know is not actually the case, which then begs the question of how can we better communicate our value? So there's a lot that can be done to fill this gap and to make sure that we as public health are really doing a good job at, like I said, conveying that value in our message and also our expertise. There's some stuff on here about data management as well and our data skills. So now let's talk about how to fill those gaps. So I'm going to go through the framing recommendations that resulted from this framework's research. And I'm just going to discuss the tools that are available to you on the Phrases website that were created by both the Frameworks Institute and Hadaway Communications. But we won't really be diving into all of those tools. I will be going into depth into one of them. So these are the 10 framing recommendations that Frameworks developed from this research that can be used to reframe public health's message to make it more compelling and to bridge some of the gaps we saw in the research. Public health professionals, when engaging with other sectors, should do their research and demonstrate their familiarity with the other sector, illustrate in words how the field has transformed over time, share success stories that give concrete examples of the benefits and the return on investment, and always to kind of keep it positive and frame the work as empowering. And there are some other kind of these metaphors and this value statement you see on here as well, which I'll go into a little bit more in depth later. And I just also would like to point out that these are framing recommendations. So they're recommendations on how to kind of package your message, not necessarily the words that you should use when delivering your message. And but we have tools to help you do that too. So I just want to quickly share those tools. So there are two types of tools. There are the framing tools and the strategic messaging tools. And all of this is available on phrases.org. And the framing tools available to you are frame elements, which I'll go over more in depth. When you say they think charts that help describe how to reframe frequently used phrasing that can undermine the meaning of your message. Answers to tough questions, and sample emails to demonstrate the written word if you're going that route as well. And then on the messaging side, there are 3 toolkits available, one on general public health communications, one specific to collaboration, and one specific to storytelling. And all of this together makes up the Phrases toolkit. And you'll see elements of the framing tools reflected in the messaging tools and vice versa. But they really all work together to help you, public health professionals, best figure out how to share your message when you're speaking to others. Okay, so a quick recap. We have talked about why communication and cross-sector collaboration are important. We've looked at the gap in understanding between public health and other sectors and the recommendations for filling that gap. And now we're going to talk about how to utilize some of these tools to drive change. But before I move on, I also just wanted to quickly mention that everything we're going over today is available in an online 3-part training that's completely free. If you just go to the phrases.org homepage, you can access it from there. And there are 3 modules, and each one will take like an hour, hour and a half, but it's a really great overview. The first one is kind of a full overview of phrases. The second one kind of deep dives into the framing, and the third one deep dives into the messaging. So if you want to revisit anything that we've discussed today, I would highly recommend taking a look at those. Okay, and with that, we're going to talk about frame elements. And the frame elements come directly from the recommendations that I had on that other slide with all those 10 tiles. And what a frame element is a communication device that alters the presentation, but not the content of the message. So I mentioned framing is kind of the package. And this is the same thing. The frame elements help you package your message in a way that makes it better, easier to understand. So we're going to start with foundations of community health. So this is an example of how it could be used. Health is the foundation of a thriving community. Public health professionals work with other sectors to build a solid foundation that supports good health for all. And that includes quality education, safe and affordable housing, and access to healthcare and employment opportunities. So one way that you could use this is that instead of using the phrase social determinants of health, you can consider describing the relevant factors of the social determinants or the conditions that you're trying to describe as the foundations of health or the foundations of community health. And what that does is it encourages other sectors to see that community health is much more than ensuring individuals can make healthy choices. So kind of those individualistic behaviors we saw when other sectors were asked about health and what impacts health. And it really kind of reframes it for them to show that health kind of depends on those reliable structures and those strong social systems that we can all help build. And it just, that individualistic piece, it also shows that health outcomes affect the entire community, not just the individual, and that by strengthening these support systems, we can improve the entire community. So I'm going to quickly show you a clip of de Beaumont's president and CEO, Brian Castrucci, using this metaphor in action. So give me a second. All right.
Who needs to be in that conversation about public health? Is that public health experts and then doctors and nurses and then the school systems? I mean, who are all the people who are stakeholders?
Everyone's a stakeholder in public health. I mean, public health is like the foundation of your house. It's not something you ever really think about, but when it fails, you think about it a lot. And so, you know, in your house, you can put up some nice wallpaper and you can put up new blinds, but ultimately you've got to pay attention to the quality of the foundation. And what we're seeing in COVID-19 is that our foundation was a little neglected.
Okay. Let's go down to the slideshow. Okay. Great. So I think that is a really great example of how foundations of community health can be used in practice. And I think that was also a very one-for-one example in explaining health is the foundation of your house. And it painted a really clear picture for people who might not understand public health and how it permeates throughout a community. So next, I'm going to talk about GPS navigation. So this is, again, an example of how it might work. Public health works like GPS navigation. Just as the GPS helps you visualize and navigate complex terrain, public health professionals draw on a wealth of data to chart out the best routes for where their community wants to be. And so this is a frame element can also be a little bit of a metaphor. And so this acts like that to help describe public health data expertise as a practical and versatile instrument. And again, it's kind of that practical piece, because in the gaps, we really saw that, and I didn't explicitly go over this, but public health professionals can often be seen as book smart, and data can be, we all know data can be seen as really hard to understand. So kind of breaking down data and public health data that's expertise in this way helps kind of describe that public health can determine intersecting priorities between public health and the other sector. It can point out important landmarks between the two sectors' goals, and also between a work plan, and also optional shortcuts and potential growth plans. And it really helps, like I said, illustrate for potential partners that public health data and data skills can be harnessed to enhance the work and not inhibit it or pull it down. But it is, just as a caution, we have to be careful when using this, this element, Not to imply that public health professionals know how to pick the best route. It's rather to show that public health can help navigate to find multiple routes that might focus, that might be help both partners work together to find the best route forward. And it's not focusing on a single one. And lastly, I'm going to talk about value of investment. And this one is particularly important because we all know that public health interventions don't often have immediate returns on investment. But to get other sectors involved, specifically the business sector, you need to show that that public health is a smart investment. And so a way that you can see this in action is that public health professionals work with other sectors to save money, and when possible, make wise long-term investments to support community health, increase efficiency, and reduce unnecessary costs. And that investing in public health leads to immediate and future benefits. So it's really kind of just trying to strike that balance between maybe some immediate benefits you might see, but overall those long-term future benefits. And what this does is it really helps to orient the thinking among potential partners towards the possibility for a joint project that can be seen as both mutually beneficial, both strategically and financially. Obviously, when you think about values investment, you think directly to financially, but this really affects strategy as well. And it can help instill confidence in the collaboration and in the project, and prove that it can achieve attainable and measurable success. And it's also important when talking about this to make sure that you're setting a clear timeline with clear outcomes and a clear dollar figure, so that you're making sure the audience is really able to receive your message and kind of see this whole package. So those three frame elements I just shared, foundations of community health, GPS navigation, and value of investment, really came directly from those framing recommendations in the framework's research. And lastly, I want to share something that comes kind of directly from the Hathaway communication side of the house for phrases, in terms of this kind of goes in the messaging toolkits. However, there is a clear connection between the two. So a narrative structure is a useful method for communicating maximum motivating power. And there's kind of four parts to this. So first is people. And in people, we want to make sure that other sectors understand the role of public health professionals and respect them as people. Second is the goal. We want to make sure that people are motivated by, or we all know that people are motivated by aspirations. And so making sure to frame the goal in a way that helps them relate the project or the collaboration to their own lives and career is really important. For the third, problems should be intuitive, making sure that we're not portraying overly complex problems is really important, because those types of problems can be seen as really hard to solve. And oftentimes you end up in that space of wicked problems when you've got something connected to something else. And then finally, the solution. Your audience will be more motivated if they can see the tangible benefits of partnering with public health. And so that actually also brings in kind of from that framing element, that value of investment piece that we were speaking about. So I'm going to pass it back off to Katie to do a little activity with you that kind of combines the narrative structure and the frame elements, so we can kind of practice some.
Thanks, Mariah. I love that overview. So thinking back, and I saw these challenges you're facing in communication showing up in the chat, and I think so many of them are connected to what Mariah was talking about, and I can see connections between them and this exercise as well. So think back to those if you can, but also feel free to bring in new ideas as well. So what we're asking you to do is just to think about a time when you might have been able to use one of these things that Mariah just talked about, and how that might have improved the way that you were able to communicate in bringing other folks to the table. So we're going to give you about 5 minutes to do this. It's helpful to write it down. Writing things down does help us learn and remember them. So just think about, from the things that Mariah shared, which frame element you would have used, and then how you would have thought about these categories of people, goal, problem, and solution as you did that. So we'll give you about 5 minutes to do that. This is really for your own purposes, but at the end of the 5 minutes, we'll take questions. So you may have questions also related to how you thought about this exercise. Okay, we'll give folks another 2 minutes or so on this exercise, and we'll come back together for to answer some questions you may have. Okay. I hope that exercise was useful just in solidifying some of what you heard. We're really eager to hear things that came up for you as we were talking through this and as you were thinking about this exercise, and also just any questions that came up for you or things that Mariah and I can answer while we're all here together. And I think you can put those in the chat. The chat's been quite active, but also just feel free to come off mute.
Guess who must have done a really good job presenting.
A
Well,
perfect
I will, while we're waiting, just quickly, if anybody has any questions, I was reading through the chat while you all were working on the activity, and I just wanted to comment on a few things, if that's okay. So I agree, there were a bunch of comments about being surprised that in that video clip, when people were asked about public health, that they really only associated it with healthcare for the poor or healthcare for those underserved communities. And I think we do so much more. And that speaks a lot to maybe what is forward facing for people and also the things that we need to bring to light. I noticed someone mentioned that it's really hard to explain the job roles in public health. And yes, even when I'm working on PHWINS, we find it really hard to explain the job roles of public health, just to even get public health people to click on the thing that most represents their role in their program area. And lastly, someone said that we needed to do a better job. I apologize that I'm kind of calling on people here, but that we need to do a better job of illustrating and emphasizing the value of prevention. And I completely agree. And I think that investing in prevention is not something that is, there is not an immediate return on that investment in prevention. And it's something that we saw time and time again over COVID. And so I think kind of utilizing some of these strategies to do a better job at really describing what public health services can accomplish will be really interesting.
Yeah, I can echo that, Mariah. We have some recent data that's out in the last couple of days showing a pattern we've been seeing since the beginning of COVID, that folks' familiarity with their local health department is increasing, where people know that there's a health department operating in their community and know something about it. But to your point, Mariah, about what's forward facing, I think increasingly folks think the role of public health is infectious disease. Those two things have become synonymous in COVID. And it's easy to see why when you look at Mariah's data about how many folks got diverged from jobs they were already doing into the COVID space, which was obviously essential at the time, but I think has created this conflation. So part of what we're doing here is just broadening how people understand the full scope of what public health is doing. We'll open it up to any other questions or things that have come up for people as you've been thinking and listening. Yeah, Christian, this is a great point in the chat about the time horizon on impact for public health. Mariah touched a little bit on this, but I'll say I do a lot of work in business and private sector engagement in health. And this is a real translation challenge in that partnership work, that businesses are thinking on a quarterly basis about what is making a difference in their business. And when we bring them together with public health folks, if we're looking, for example, at early childhood interventions, we're talking about decades worth of measurement to figure out how that investment is paying off. And so I do agree that having the data infrastructure to do this well, but also having the communication tools to be able to do that translation work In the business and public health space, we often find that we're talking about really similar things, but we're using different language and different time horizons to measure them. All right, I'm not hearing any more questions. Mariah mentioned a couple of times in the presentation that you can find all of the things that we talked about today at phrases.org. So I hope you all write down that web address and go and explore everything that's there. We have much, much more in-depth resources and trainings for you. You can also find additional resources on our website where we're regularly sharing data as it comes out, and also through the Public Health Communications Collaborative, which is at publichealthcollaborative.org. And so I encourage you to be in touch with both of those resources as well.